Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations. Clinics, hospitals, point of service, emergency departments, private offices, echovascular, general, high-risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. Today's guest is Dr. Ronald Gray. He is currently the program director for the Diagnostic Medical Sonography program at Pima Medical Institute. Previously, he worked for Honor Health for 20 years, with the last 4 years at the Sonography Crossing Medical Center. At this facility, Dr. Gray was the lead ultrasound technologist and clinical instructor. This role helped to build a foundation for the new ultrasound department to grow with the Honor Health system. Dr. Gray is a current member of the Society of Diagnostic Medical Sonography, and 2017 was on the board of advisors for a Venous Access program at Gateway Community College. Dr. Gray earned a master's in business administration with an emphasis in health system management from Grand Canyon University, and finished his doctorate in business administration with an emphasis in management in July of 2024. Congratulations, Dr. Gray. Prior to the master's degree, Dr. Gray earned a bachelor's degree in kinesiology from Arizona State University in 2001, with 2 associate's degrees from Gateway Community College in 2004 and 2010. 2004 associates in nuclear medicine and 2010 associates in ultrasound. Dr. Gray in 2018 cross-trained in computed tomography, CT, and 2019 passed the board exam to be licensed in CT. The field of research that has pursued associates with the doctorate of business administration with an emphasis in management is related to the healthcare industry, specifically medical imaging. Dr. Gray used quantitative methods to explore the budget concerns and confidence level of practitioners' use of ultrasound equipment in the emergency room, with a concentration on examinations that can be performed outside of this setting, specifically urgent care, hopefully showing management teams in the field of medical imaging the need to provide better evaluation of exams that can be performed in the urgent care setting rather than sending the patient to the emergency room of a hospital. Dr. Gray's long-term professional goals are to attain an executive level position to manage a healthcare system as a CEO, and attain a position as a professor at a university to teach online classes in the areas of business and healthcare. Please help me welcome Dr. Ronald Gray. Dr. Gray, thank you for joining us today again to share your wisdom and experience with us in regard to transitions. You've recently transitioned from education, I believe, to back to the healthcare endeavor. So tell us a little bit about that. Well, tell us first how you got into it. Let's start there, because I know we've talked to you before, but for those of us who are just joining us and haven't heard that, tell us about that journey a little bit first.
So the journey that I took for just in general in healthcare, I guess I'll take it back a little bit. I started out as a pharmacy tech right out of college. I didn't know what I wanted to do. One of my friends was like, "Wait, why don't you be a pharmacist?" And I was like, "Well, that's really cool." And so then I became a pharmacy tech just to see if I was even going to like being in that environment. And I was going through the transition of going to pharmacy school, or at least trying to get into a school here in Arizona. And then somebody handed me a pamphlet at the community college I was going to for some of the prereqs for nuclear medicine. And I read the brochure and I talked to a few people, and I was like, this seems like a better fit for what I want to do with my life. as with everything, you look at, the pay and requirements and just how that fits with your overall interest in your career. And it aligned pretty well. It was going to require me to know physics and understand chemistry of the body and how radioisotopes interact with different organs to help produce images. So then I was like, okay, that's my pathway. That's what I'm going to go to school for. I don't want to do pharmacy. It's a very wonderful field, but it's not where I felt my heart was. And so then when I was going through some prereq courses for the nuke med program, a program director for ultrasound taught a course on clinical pathophysiology. And I wrote a paper for her course, and she was like, "Hey, you wrote that paper really well, and you seem pretty astute." And I was like, "Are you doing this to all the students to get them to be
Right?
a part of your program?" And so it turns out she was the program director for the ultrasound program at the same school that I went. And I was like, you know what, I'll think about it. And, I have to finish my school and get into the career to really dive into medical imaging to see if that's something I wanted to really do as an extension of what I was already going to school for. Well, in between there, because I finished school in 2004, and then I went to ultrasound school in 2008, but between there was a certificate program for CAT scan. So I was like, ooh, I want to do CAT scan. It's going to help me in my nuke med career. Well, I did all the courses. And oddly enough, there was a weird transition in that time where nuke med techs could not go and do clinicals. So you couldn't finish the certificate program. I was like, okay, well, I have all the background and knowledge. So let me just keep moving forward. A little quote from one of our favorite animator creators. And so then I went to ultrasound school. And then as I went along, I went and got more education to be in management and moved up a little bit in that regard, where I became a clinical instructor. Uh, but I also noticed that hours were being taken away because that happens frequently in the healthcare field. If productivity goes down,
Right.
then the people that are involved with that productivity, they're like, please go home, please. Um, and
Yeah.
so I was like, well, let me devise a way that will help me and the department. So I hailed back to my educational experience in CAT scan, and I always wanted to complete that. So then in 2018, in about June, I cross-trained into CAT scan. I went 1 day a week, like every Friday, for 8 hours. And I got all my competencies and everything signed off. And then I did not online. It was like a program that was through a company where they had 8 modules, and those modules fulfilled the ARRT requirements. And so then I did all of that in January of 2019. I took the board exam and passed. And so then, thank you. Excuse me. And then once I did that, I started dabbling in each one of the modalities that I could do. And then as we go with transition, I moved into a lead role at the facility that I've mentioned before, where I was exclusively in ultrasound. I didn't get to practice that much in nuke med and CT like I wanted to. Um, and so then I just kept getting more education because I really wanted to expand on those leadership skills. And then, I got through all my degrees and things. And then I was like, well, let me take my experiences in medical imaging and see if I can transition them into a higher level leadership role. And being a program director at the school was my next step. And I did that for about a year and 3 months. And, you know, being an instructor and a program director and things is very wonderful, and it does fill your cup, so to speak. But when your cup is 16 ounces and only 8 ounces of it is full, and you want the full 16,
Yeah.
you start looking other places.
Right. Right.
And so then I slowly started maneuvering and looking out and looking at jobs. And honestly, my wife, who works for the same healthcare institution I currently do now, she was like, hey, there's these openings at Banner Thunderbird. And so then I applied, and here we are today.
Awesome. That's amazing. I love
Thank you.
hearing people's journeys, right? Because it's never a linear line, right? It's
Yes.
this zigzag. It's always, well, let me try this. Okay, well, let me go here and try this. and different things such as that. So I love to hear about people's journeys because, I think oftentimes we get this linear perspective of, okay, I'm going to go from point A to point B, and then from point B to point C, and point C to point D.
Yeah,
And that's just not how it works. Like you just kind of follow your heart and you do what is presented in front of you. And then you, in the end, kind of end up doing something that your heart desires, right?
yeah, exactly. Yeah.
I think, anyway, in my opinion. So, um, let's see, let's start with the transition from the education back in your most recent transition
Yeah,
of from education into healthcare management. Is that correct?
that is correct. Yes.
Okay. So tell me about that because first describe maybe a little bit about the responsibilities in the educational sphere of things.
Yeah, it's a very interesting thing that I didn't
Kind of frozen up a little bit.
in the educational realm when you're over a products.
Kind of frozen again. I don't know. There you are. Sorry. Hmm. Are you still
Yeah, I can see.
okay? Well, you keep freezing. I don't know what that's about. Let me see if I'm having issues on my phone.
And all of a sudden it started.
We good?
I think we're good.
Okay.
So to go back to the question at hand, educational wise, it requires you to look at different facets of education from like I was saying, the textbook evaluation to figure out what's going to be the best course of action for providing the best educational experience through our textbooks. So the decision making processes were mine to make. Um, I will say that we came as a collective group where it wasn't just me for my program. There were other program directors involved. We would have meetings and things to really dive down deep and look at, what's the best course of action? Is this textbook going to have another volume? Is it going to be, stopping there? How can we leverage the textbook to give our students the best experience? Does it provide extra like online tools and things like that? Um, then the other aspect is that you're having to make sure that you're scheduling your program correctly. What I mean by that is there were afternoon and there were morning cohorts, and each cohort was only there for 4 hours each time. And so you had to make sure that when you align those, that you make sure you're in the right semester and you've given them the right classes and different aspects like that. The other thing is, in my role, I had to come up with protocols for the lab component. Um, I think ultrasound is unique in the fact that we have a physical lab where the students scan their fellow colleagues. So making sure those protocols are relatively up to date of what the student would see um, is very fascinating because everybody has a different opinion on what things are. But as we all know in the healthcare industry, everything is driven by doctors, specifically the radiologist. And if the radiologist wants to see X, Y, and Z things, that's what we need to provide. And also to go along with that, they go by their own governing board of like what is supposed to be in
Right.
the medical imaging exam of X, Y, and Z body part. And so it kind of transverses down the line. And if we're not teaching exactly what's needed in the hospital, then we're doing a disservice to the student. Um, the interesting thing about schools is when you get a larger school that has multiple campuses across multiple states, you have to make sure that you start aligning everything correctly with each one of the other campuses. Um, I'm sure you've experienced, and I'm sure somebody in our audience could also state that when you go from one state to another and there's a school, you want that school, if you leave semester 3 and you pick back up semester 3, but the 5th week, you want to make sure that you're getting the exact same information where you can just pick up and go so you don't lose any traction. And so I had to deal with and help align those sorts of things because not all of our programs were aligning in that way, which was mind blowing because I'm used to healthcare networks having that alignment. When you, even as a tech, you're like, oh, I go to this location of this health network, it's going to be the same protocol, the same types of machines that you're going to see at the other location that might be 20 miles away.
Right. Give or take, right? There's
Yeah.
always nuances to it.
Yes.
And every doctor brings its own unique experience, right? And so I remember even in scanning pancreases back then, we did a lot of experimenting with filling the stomach to see the pancreas and different things like that. And so some doctors would have part of that to be part of the protocol, even though it wasn't part of their governing body protocol, it was what they wanted, you know. Um,
Yeah.
so, yeah, but it's nice to have that governing body, right? In order to have guidelines for everyone, right? So we're all kind
Oh,
of on the
yeah.
same page. So, yeah, but making sure there's a consistency, that can be quite a chore across state lines. I would,
Yes.
as a
It,
traveler, that is really a feat, I would say.
yes, definitely. And like you said, everybody has a different opinion of what the right thing is. And, you know, as a school, they have a governing board. And if you give them your platform of what you are going to teach and how you're going to teach it and what's going to be represented in each course, specifically a lab course, it needs to be aligned because that governing board governs your school no matter whether you've got one campus or 17. Those 17 all have to follow a guideline.
Right.
And when you don't find those, you've got to collaborate with those teammates to try to get that alignment um, more cohesive.
Yeah. Yeah, which is the big a challenge, right? Because when you're in management, it's not your ideas moving forward, it's the collaborative movement.
Yes.
And so being able to marry all those different ideas together to enhance the whole, right?
Yeah, exactly.
Yeah. So how is that then different than in the healthcare environment? Because as management, because in management, you're kind of still doing the same thing, right? You're
Yeah.
to manage the department, but you're still using you're in a position where you're wanting collaboration and ideas and being able to use their ideas in collaboration.
Yeah, you honestly, when you go into a health management and healthcare, you collaborate, like you said, but you have your own vision of how you want things to be. And before you can even think about instituting that vision, you need to figure out where everybody is in the moment. So, you step into a role and, if whether they've had somebody for 3 years that was a manager, and then, somebody new steps in, or they haven't had somebody for several years, you've got to figure out, okay, what was working and what wasn't working. And so that was something that I tried, or I've been doing in my current role, as I didn't want to reinvent the wheel. I also didn't want to start bringing my ideas as like they're the absolute, because they're not. I mean, everybody has their own idea. It's just, how do you incorporate everybody's idea to make a certain percentage happy? And I say it that way because not everybody's going to be happy, and you're never going to make everybody happy, but you can align things that make the department, number one, run well, and number two, maybe make compromises in certain areas to help pull back on that resistance of those people that aren't going to follow along, because you already know that you're going to get a certain amount of diffusion of ideas, so to speak. Um, I'm thinking of a concept that I used in my paper, where you incorporate something new, and then you get all these people that are really excited to start jumping on it, and then it trends down where there's less and less people that want to do that. And so you've got all these people collectively at the front, but you got those few stragglers that really, in a healthcare environment, they can pull on those early adopters. They can change that outlook or that environment. And so it's adjusting to those things and making those compromises to ensure that your vision of what you want to accomplish in that department works. And it's always an iterative process. It's not always like, oh, I came in and I adjusted and I assigned people to rooms and that's going to work. Well, people change, their lives change, their their schedules change, people leave jobs, new people come on. So it is a constant back and forth adjustment to all of those things. But at the end of the day, your ultimate goal for any department in healthcare is that you want to make sure your patients get the imaging that they need, what that is done well, that is done by the protocol that we've already talked about, that's driven from those governing bodies, and that they are able to, the patients are able to get their diagnosis and treatments, and they can get in and out of the hospital as quickly as possible.
Yeah, to hit the patient satisfaction scores, right?
Oh, yes,
Right.
yeah,
Because not only are we trying to um, meet all these goals and make the people that you're working with satisfied, um, you're also all there to satisfy the patient, right?
yes, exactly.
For the patient experience. So, yeah, it feels like a never-ending defeating
Yeah,
right? Like, I don't know. It just feels like a job where you're playing like whack-a-mole, that old game where you just kept hitting this and
yes.
whatever pops up, right? Um, but it's ever changing, right? And so I think as for lack of a better word, the Indians, us worker bees, you know,
Yeah.
who are working can sometimes be frustrating, that things are constantly moving and changing. How do you, because in any given department, you have people who are really positive and willing to accept change and move forward and try new things, and then you have the people who really don't want to do anything, kind of curmudgeons. Do you have any specific ideas or suggestions in order to know how to bring that negative energy up?
You know what I try to do is just be an example for everybody. I also try to do that servant leadership role, which they go together really, because if you're a servant leadership and you're setting the example, I think that helps. And also being present in the department, not being a removed supervisor or manager. A lot of times, what happens is people forget what it means to be a technologist, no matter what imaging modality.
Right.
And if you make your presence known and you do rounding periodically throughout the day and you check in with people, and maybe you have to adjust your schedule every once in a while, like go really early in the morning so you can hit those people that sometimes might be those curmudgeons, because a lot of times they've been there for a while and they don't want to be bothered, so they work at night.
Right, right.
And so you can hear their feedback. Whether you can take that feedback and do anything with it, the idea that you're there and you listen to them, that can sometimes help reduce their curmudgeonness. I know I just created a word.
Yeah, no, I love it. Yeah, I love it. It's hard. And I think as someone who's been doing ultrasound for 30 years myself, it's a challenge that I present to myself often, right? Like, how long are you going to complain about this? Like
Yeah.
some things are just going to be that way, and that some things you're not going to be able to change. So, how do you accept it and move on? How do you find fulfillment in your job? And sometimes the fulfillment isn't always in the job. I think life is, if you're not fulfilled on the outside, or if things on the outside of work aren't going well, it can spill over into the work, right? So sometimes we focus on trying to make the outside work better to make the work better,
Yeah.
from a personal growth idea, right? Tell us about your fulfillment. Like you said, for teaching, your cup was, 8% full versus 16. And so now you're going into healthcare. How does healthcare management feel? How do you get fulfillment with that? Because that's a very different type of environment, right? When you're teaching someone new and they get these light bulb moments and you can see them go off in their head, and you're like, "Wow, okay, I really made an impact there," right? But in management, do you get that? Do you get those kind of fulfilling light bulb moments that are opportunities where, wow, I've really made a difference or change there?
Yeah, I think you do. I think it truly depends on the situation. Education is interesting because when you get into it, you're starting with somebody who may not have ever been in healthcare.
Right.
Somebody in our field of ultrasound has never touched a transducer, or nuke med and CT. You've never injected anybody, and you've never shot an X-ray. And so getting people to understand those aspects, um, for me, and I'm right where I'm going with that is the sense of fulfillment. It became very regimented, where I had wonderful students who you could see their eyes go, "Oh my gosh, that's how you find the pancreas or the liver."
Right.
But those light bulb moments, they were always there, but they always felt the same. It didn't feel different. So then it became very regimented, and your every day became very much where you were like, okay, this is the same thing I'm going to get up and do every day. And I know I'm helping to create a future of individuals that are going to be successful, but I also need to have my cup filled because I didn't think that I could continue with that same regimented
Yeah.
work style.
You needed a bit more of a challenge for yourself personally.
Yes, I did. And students are wonderful and it's great. The nice thing is when you go into healthcare, um, those those moments that we're talking about, you get it when you start to get camaraderie with your colleagues. And I call them colleagues because I don't think it's fair to be like, oh, I'm their manager. Well, that's not appropriate. We're all here for the same thing, and I'm there to support them. And if I need it, I want them to support me. So if I have a request, I know that I can get it done through them. So there's that aspect that is missing in education. The other thing is you also get the educational piece when you have individuals that come to your department from a school because they have to do clinicals.
Right.
So you're getting to educate them, and they already have their basics down. It's not going to be the same every day with that student. They already know how to handle the transducer or inject or expose that X-ray. It's more the idea of them getting to recognize pathology and understanding a new protocol that maybe they didn't learn in school. And so it feels like that fulfillment becomes that 16-ounce cup because you get all of the areas in the healthcare environment when unfortunately in education, at least our area of education, you are lacking where it becomes very regimented, at least in my experience. And I'm only speaking of me, and somebody else could have the complete opposite.
Sure, sure, sure. Yeah, so what I hear you saying a lot is about relationships, right?
Yeah,
You build relationships with students, and that is pretty regimented, right? You know when the light bulb's going to go off for them. You know the
yeah,
light bulb that's going to go off because there's such a large learning curve there, right? Whereas in the healthcare field, you get that, but you get other challenges along the way for your mental capacity and different relationships, right? You collaborate with different people for different things and to try to move certain things forward. So departments forward. Um, Talking about maybe I have a question, but I don't know when it's going to be appropriate to ask. Let me just go ahead and ask.
okay,
Um, So in healthcare, I guess this is part of the next requirements of healthcare versus educational career, right? Um, in healthcare, we get in, we learn the skill of ultrasound, we're scanning, we're learning our pathology, we're learning different body types and different physics to use with that. But then there's also this part of learning that medicine is a business, right?
yeah,
How to not only just do a really competent job and go above and beyond technically, but also how do we make this a patient experience that is good for everyone, right? In order to move, in order for them to want to come back, in order to move the needle forward on a business platform, right?
yeah.
So, how do you bring that to your people? to kind of get around? Because I know a lot of ultrasound techs are all about patient care, and it's harder to understand the limitations that healthcare has as far as reimbursements and um, you know, things being available to us in order to do our job. Or, we're not getting the top of the line equipment every year. Or,
Right.
you know what I'm saying? Like, I have friends in legal and architect and engineering and IT, and those businesses run very different than healthcare does, right? And so trying to get your teams around the idea of not only are we giving patient care and that's our main focus, but we also have a business to run. So how can we use our resources and come up with ideas that don't cost any money,
Right. Yeah.
make things better and move us forward as a healthcare um, initiative, right?
Yeah, I think to go along with that, we have to think outside the box, obviously.
Right.
You know, when you think of healthcare, it's the small things that can make a difference. Because we do go off of patient satisfaction surveys and we have to watch our budgets. So we're not buying, we would like to all buy the top of the line equipment like you indicated, but clearly that's not always a possibility. But if we do small things like we adjust a way a piece of equipment can be used, um, and allowing more increase in the amount of you can scan. So where I'm going with that is, um, if you find out a piece of equipment isn't necessarily being used all that often, and it has been sitting there, but it's used and it's a little older, but it can do a multitude of things. Um, a small thing is, try to figure out ways to make that equipment work for your needs. So if you have an increase in patient need, well, what can we do to add to that equipment? So you can add like a specific protocol that specific, and what I'm thinking is for radiation. So you can add a protocol that maybe is present on one machine, but you have to add it in a different way to maybe keep the dose, which dose meaning you don't want to expose a patient to a huge amount of radiation. So figure out a way to reduce the dose and then have that protocol initiated on another machine. So then that way you're using an older piece of equipment for the same purposes as maybe the newer piece, and you can get more patients through, which then does ultimately affect our patient satisfaction survey because they're going to go, yay, I got done much more quickly than I've experienced in the past. Um, Things also too, like figuring out a better workflow. So, I mean, if you're only using two machines, but you have three, maybe we should figure out ways of adjusting our schedules and seeing how we can leverage the employees that we have to start moving them over to using another piece of equipment, which once again harkens back to getting patients through the hospital more quickly. And I know that sounds like a manufacturer type concept, but it really isn't. What we're trying to do is get the results to them more quickly, or at least get the results to the physicians more quickly. So then that way they can make a faster, better diagnosis for that patient. Because, if somebody's having a stroke or a heart attack, those minutes matter.
Right.
And if they can get, an obstructive stroke like event going, the treatment quicker, that's going to save their brain, the areas of the brain that's going to be affected by that,
Right.
and much faster. Yeah. So it's those little things that I think that we can adjust overall, which then also lead into bigger things. If you get increased amount of patient satisfaction, meaning more people want to go to your facility, more people are getting pushed through, then that allows you to expand maybe your workforce. And it shows the higher ups, and in most or all healthcare institutions have a C-suite. So you show those C-suite individuals that make those big decisions. Hey, we've got an increase in all of these areas. We need better equipment. We need to update it with, the latest and greatest, or, whatever qualifies for the latest and greatest for your population of patients.
Right.
And then that can allow us to do even more things. We can offer bigger, better programs that are related to other areas that maybe your hospital doesn't look at.
Right. Um, yeah. That's a bigger picture, right?
Yeah,
And
definitely. Yeah.
you utilizing things and making them more user friendly. And do you have restrictions like in ultrasound, the big push recently has been, there's some places I've been to and patient, ultrasound techs are doing 25 scans a day, right? And others are, so there's been regulations or recommendations that have come out to say for this specialty, this amount of scans per day would be recommended, right? So you have limitations on how much you can perform so that you're not hurting yourself, right?
Right.
Um, but also, physicians are reimbursed or paid according to how much they charge for the hospital, right? So
Yeah.
always balancing that production, um, versus injury to the worker bees, right? Um, so have you had to, does Nuke Med have restraints like that in regard to, I guess they're not pushing on patients or um, manually having to do as
No, because you are correct. Ultrasound is different in the idea that you as a person do 25 exams. You're physically harming yourself to some level.
right,
Um, I think the balance comes where if you can show that there's an increase in the amount of that shows that you need more help. It's not going to reduce the amount of scans they order because at the end of the day,
right. They're going to order them regardless.
the doctor's the doctor and they're yeah, exactly. But if we can show, a need and bring more people in, so then that way that need is met, that will help reduce those injuries. And I can even CAT scan. Nuke Med's a little different because it's a wonderful modality, but it's a little nowadays a little less intense patient wise. We would love it to be more intense, but things change and modalities adapt to the time. And so some things that were always done in Nuke Med can now be done through ultrasound and CAT scan. But increasing patient need will help show the need of increasing your workforce. I think one of the things that we need to do to adjust all of those things is, and I know that we all do this and we all do it in different ways, but I'm thinking critical thinking. So if you have a patient that, let's say needs an AV fistula evaluation and the radiologist is ordering a CAT scan with contrast, we need to go, hey, wait a minute, that feels like that's going to be a lot of radiation and a lot of contrast through an area of the body that can be seen very, very easily under ultrasound. Maybe we should speak with the physician. Obviously, we're not doctors, but we have a level of thinking that we can communicate effectively and
Right,
say, hey, we're just double checking with you. This is where we think it should go imaging wise. Would you prefer to do the ultrasound first because we have an increase in patient acuity and all these exams? In CAT scan, maybe we should order the ultrasound. It might get done a little more quickly because they're more portable. And so if both sides do that. So, if you have a retroperitoneal bleed, we don't typically see that very well in ultrasound. If you see that as an area, maybe we should be like, hey, can you look at this and maybe order the CAT scan because I don't think I'm going to see this, or that renal artery Doppler. Hey, they had a CTA of the chest. Is this going to be good enough because they went through those renal arteries in the CTA? Do we really need to do that ultrasound to help reduce our physical burden?
right, right. Yeah, I think critical thinking and preparation, looking ahead and seeing what they have had and how that might affect our scan or the care for the patient. Either way,
Yeah.
it's imperative. Yeah. Tell me about the transition from being a technologist, that way of thinking, to the thinking of being a manager in a healthcare. What kind of changes have you had to make or adjust when changing a position like that? Because in the world of ultrasound, my personal experience has been recently, especially, is they hire really good technical people to be managers, but managers need people skills. And maybe they
Yeah.
don't have the people skills, but they're excellent techs, right? So I see a big gap in healthcare as far as the training that hospitals can give to possible mid-managers, for knowing how to manage people as opposed to being a technologist. So tell me the changes that you've had to adjust or embrace or in order to make that successful for you.
It really is a balancing act because you have to take authority and be able to speak with authority in an area and say, hey, this is not working. This is what we're going to do to change it. At the same time, though, you also have to have the buy-in from all of your coworkers, whether you're new to the department or you've been there for a very long time, there's still a buy-in because at some level they're gonna see you if you've always been there as their friend or that colleague that has just always been around. And if you're new, they're gonna test you and see what they can get away with. Um, from a servant leadership type viewpoint will help. And what I mean by that is, once again, listen to them. Don't just walk in. And I think this is what you were pointing to is some people just walk in and go, this is how we're doing it. I'm the manager now. This is what we're looking at. It's budgets. It's you're not doing this correctly. And in my experience from just watching managers and the different educational things that I've gone through, and I know that you've gone through several, it's not, you've got to take a middle stance. You've got to take, hey, I'm going to take what people are giving me, kind of like we mentioned at the beginning, and mold it to what's going to be the best need for the department and present it in a way that is not confrontational. It's a thank you so much for being such a wonderful team and embracing this change because whether it's a new manager or somebody that transitioned, you've embraced this change and this is what we're going to do to try and maneuver the department to make it better as a team. So you're taking it as a team perspective and then also showing up and being that servant leadership where if they need help moving a patient, if they need help collecting supplies to go do a portable paracentesis, if they need you to go get a patient, doing all of those things, not worrying about, oh well, I'm in this role, I don't have to get my hands dirty. I think all of those things make for a better department and a better acceptance of whomever it is that comes in to be in that role, whether they're new to the facility or have been there for like a gajillion years. A gajillion's an actual medical number.
Term, Jillian, I love it.
Yeah,
Nice to know. Uh, yeah, it's different, right?
it is.
What's been your biggest struggle with that then?
Honestly, is the people who are curmudgeonous. That once again, the word we made up. I'm trying to figure out the line of making sure to assert what needs to be done and what is requested out of them, but also at the same time not being so forceful that you create confrontation because there is a balance and usually those people they don't want confrontation but you know if you push their buttons it could get to that point and really nobody wants that at
Right,
all. You just want them to know that this is what needs to get done. I'm here for you, but we also need to ride the line of these are the rules that all of us need to follow.
right, right.
So
Yeah,
that's been the hardest part for me is trying to figure out how not to um, make those situations tougher for either one of us because at the end of the day we're all people so we both have two sides of what we're looking at
right,
and I need to see it from their perspective but I also need them to have that buy-in and see it from mine too.
right, right. Yeah, and using terminology, is it possible you could see it this way? Or,
Yeah.
you know, what kind of phrases or terminology do you use in order to try to get someone to possibly see it a different way? Do you have any go-tos at all or
When somebody complains and is in that mind frame, I usually go, well, what do you think we can do differently to make it better? And usually they'll have an answer, and then I'll go, okay, let's think about it. And then I also present the reasoning behind why a request is being made, because sometimes that's what irritates them is they don't know why it's being made.
oh. Hmm.
Something as simple as like, hey, we have this electrical surge protector strip that was bought from X, Y, and Z company. It's sitting on the desk. Well, it may be rated for a phone charger, but it's not rated to be inside the hospital.
Right.
And when we have these commissions come through and look at things, we need to make sure that we're abiding by their rules.
Right.
And so I get why you have that here, but let's look. Can you help me? That's another thing I do is can you help me find it, like in this example, can you help me find a surge protector that we already have in our hospital that's been looked at by facilities and has a sticker on it? That way it also helps give them something that makes them feel like their voice is being heard.
Right.
Um, Oddly enough, I feel like even in society today, everybody just wants a voice to be heard.
Yeah, we want to be seen, right?
Yeah.
I think that more than anything. I was talking with someone the other day about a patient who came in, was crying, is upset and holding her side, and she was with her husband, and I scanned her while a nurse was talking to her to help expedite some time frames that she had missed. And so she left and wasn't crying, wasn't upset, wasn't holding her side, and we did absolutely nothing but listen to her, you know? And I thought, interesting, like
Yeah.
she just wanted to be seen and heard and acknowledged, right? Like that that's normal, that sucks. Um we're not sure that we can take that away, but here are some ideas. Have you tried any of these? Like you've got to
Yeah.
get creative within yourself in order to figure that out. Because it's different for everybody, right?
Yeah.
And so to just say, yes, we see you, yes, we hear you, um, and empower her with a few ideas and let her kind of work with that from there. And it's almost like a miracle, right? It's like, blah,
Right.
pain when we didn't touch her, So I do think you're right when it comes to colleagues that sometimes we just want to feel like we have a voice or a part of the whole, you know,
Yeah.
that we matter, that our voice matters, kind of, I think.
Now that you say that, it makes me also think of another aspect related to the educational piece that is different from the healthcare piece, which is students are students and they're always heard because their opinions completely matter. It's their education. However, students at times, and I'm sure all of us have fallen into this little weird zone where you think that your opinion is the only one that matters because I'm being educated by these individuals. And you forget that the individuals that are teaching you also have a voice and have things that they're trying to maneuver. And students forget that. And when you get into healthcare, which is what I like when we get students in the healthcare environment, it's their light bulb moment. They go, oh my gosh, it's not just
Instructor.
me and getting my education and getting my grades. Yeah, I have to maneuver all of these other aspects of healthcare and give a patient an actual exam that means something so somebody can obviously doctor can figure out what's going on. And that is definitely another thing I noticed between education and healthcare is students tend to think that I'm paying you to teach me, so if I demand X, Y, and Z things, then it needs to happen.
Yeah. 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 I think when you're a student, you're right. I'm paying for this. I should have this experience or have this, yeah, expectations. So really it's managing expectations,
Yeah.
right? Yeah. Um, yeah. That's that's it. that's a challenge in and of itself. So you're managing expectations of students, but do you also manage expectations of your department then, right? As well?
Yeah.
Perfect. Yeah. What are your thoughts on, I read
And
a
so
book.
those aspects, no, go ahead.
No, no, no. I want you to finish because I'm going to transition to a different idea here.
Oh, okay. I was going to say, yeah, it's the same thing because there's expectations that are laid out to somebody in my role from people who are higher up who have been in my role and now they've moved up. And you've got to balance that with the needs of the employees. And when you're doing that, you need to show your managers, which I have two amazing managers, what I'm doing and how that's affecting the patients and the employees. And is it working? And if it's working, they're going to say, yes, you're doing the right thing. If it's not working, they're going to either redirect you or ask you, if you see that it's not working, what are you doing differently? So, yeah, there's a little bit of a pressure to maneuver those areas of a department.
Which is kind of cool because as a middle management, it sounds like your mentorship is really important, right? Like you have people that you're accountable to for what you're doing um, to better that situation or communicate differently with that situation. Is that what I'm hearing from you? Is that you're hearing from your
Yes.
colleagues, but having to take it and move it forward through healthcare, right? With accountability.
Yeah.
Yeah.
Yes, and my management team, they're amazing because they listen and they support and they give me information that says, "Hey, I love the idea, but let's see if we can tweak it," because they have expectations that are driven from their leadership team. And so then it actually all works out very well, especially when you have a good, solid management team along all the lines. When you've got one of those lines broken, then it starts to rock the boat, so to speak.
Yeah, it sounds like there a lot of clarity that comes from the top down,
Yeah.
right? And how to
Yeah.
support that throughout the whole system and how to be creative to bring that um what's the word I'm looking for? That mission that they're trying to move forward. So here's the mission, and we're trying to move this forward and allowing all the downward management come up with the ideas on how to implement it within their department. Does that sound right or reasonable?
Yeah. The computer froze a little bit.
Yeah, yeah, yeah. Perfect. Yeah. So recently I read a book and I was just trying to figure out, try to remember the name of it, but it talked about, oh, it was a manager that was in charge of a restaurant, a very high end, top of the line restaurant, and they were trying to um, make the dining experience the best experience someone's ever had. Right? Not only just the food, but the experience with the food. Right? And they kind of contrasted it to this possibly working in healthcare.
Okay.
Um, what kind of experience can we bring to our patients um, in accordance with the high level of technology or expertise, right? So, what are your thoughts on that?
I think it's interesting because healthcare does pull from other industries. Like one of the healthcare networks I worked for, they looked at like Toyota
Mhm.
and pulled like from how they manage and evaluate the way vehicles are made and how the management team works. And they've like adopted different things like that. So there's like a huddle board that reports out different metrics to show how things are going in the department. There was the section for like kudos or you did really really good with this patient. Um, I,
Right.
I think that healthcare in general, like we've already said, is unique, but it's not so unique that we can't try and look at different areas of business to see what we can pull from them. Because yes, we have patience and we have obstacles, but maybe something they're doing in the restaurant industry, we can pull from just enough to maybe tweak something in healthcare that'll make that better for the patient. Um, so yeah, it's a very interesting concept. I think it could work if it's leveraged in the right way.
Yeah, it was interesting because some of the one of the examples that it was given is that they came into this very exquisite restaurant, right? With expensive, top of the line, five-star restaurants, right? Is what they were their goal was in achieving. And this party of four came in and they were coming to visit New York. It's a restaurant in New York. And they said, we've been to all these nice places and tried all these great restaurants, but we never got to try a New York hot dog off of the street, from the vending machine, the vendor
Yeah.
the street. And they had overheard their conversation. And so the manager went down and got a hot dog off from a vendor off the street and brought it up and then split it into four ways and had to really do some serious convincing to the chef to serve um, a one bite taste of this hot dog off the street. And so it didn't cost, but what, $1.99 or whatever the hot dog is off the
Right.
street, right? To make their experience outstanding, right? That they didn't leave New York without trying the hot dog vendor, right? So he was talking about these small things that we can do to make people's experiences um, so much better um, as an experience. And so with our healthcare going to almost a experience based, and a lot of times patient satisfaction push, I wonder how much of the focus gets put on the patient's experience versus other things, other priorities in the hospital.
From my experience, I think that healthcare in general looks at every aspect. Like we already said, the patient care part, but then they look at what happens when the patient walks through the front door. Just like you said, that expensive restaurant they overheard. Well, I'm sure that somebody somewhere has overheard, hey, this hospital looks run down, outdated. And if it's from like a big, huge health network, we already know that those health networks are doing well for themselves. So those health networks are listening to those things and they're remodeling like the fronts of the hospital, and they're putting in new furniture. They're putting in, furniture that you can plug your phone into, or chargers, or just giving them little things.
Yeah.
Um, even as a healthcare worker, the small things will work for our patients. Um, I've seen different things, and one of the things that stands out is that if a patient's in need and it's within your scope of practice, you should do what you can for that patient. So, I had an incident where a patient was in the ER, and I scanned them, and they had had an accident. And so rather than leaving the room and going to find a nurse, I left the room and found the supplies to clean him up. And um, it, it was interesting because I couldn't find one of the supplies. I had brought back everything. We started through the process of cleaning the individual up, or I did. It was just me. And I went out to go ask a couple of nurses, and I said, "Hey, where is this product?" And they're like, "Why do you need that product?" And I said, "Well, the patient had X, Y, and Z things happen. I'm done with my exam. I'm doing this." They're like, "Well, why are you doing that? That's not your job." And I was like, well, yeah, it is. And where's that product? Like, you can come in and help me, please,
Yeah.
because I'm only one person, but
Right.
it is my job. And so, like, those small things, whether it's taking it from changing the front lobby into more of a luxurious hotel look that's more inviting, or having just any one person do that one extensive or extension act, all make a difference to leverage that patient experience and change aspects of healthcare to be similar to like what that restaurant did, where they probably got rave reviews from that family, and that family probably said, "Hey, go to this restaurant," and they will do everything they can to make your experience like top notch in New York.
Right, right. Yeah, because a lot of it is referral based, right? And
Hmm.
if you have a good reputation in the community and patients like to go there, then patients are going to ask their physicians, "Can you send me to here?" Or
Yeah.
that, So, yeah, I just had wondered from a management point of view how much emphasis they really put on that. But I guess you're right. My experience is they really do look at the whole, right?
Yeah.
Um, and we don't know that they're looking at the whole, when we're lower on the totem pole, right? We don't have
Right.
conversations. So, um, yeah.
I will say though, sorry, I think that's more of a newer evaluation,
Mhm.
where people have now started really looking at the whole. I think before it was looking at, you know, we have the chief of medicine. He said to do this. Okay, everybody's going to do X, Y, and Z things.
Right.
And now we have it where there's multiple viewpoints coming around. Um, and one kind of silly example is, a long time ago when I started my ultrasound career, actually when I was a student, they used to have carpet on the floors of the hospital, which
Yeah.
is so weird to me.
Weird.
And it wasn't very like nice carpet either. It was obviously very like, well, we're gonna get what looks nice, but we've got to get something on the floor.
Right.
And people started noticing that like it's getting stained, and
Huh?
I'm sure joint commission and things like that come into play, but like it didn't make the hospital look like a hotel. It made it look like a really rundown medical facility that people don't care about. All they care is, you know, let's get the patient in and out of here. That's all we really care about.
Right.
And now you see like better lighting and better flooring on the floor that is much more amenable to, unfortunately, to say like body fluids getting on it.
Right.
Or if somebody spills a drink, we can mop it up really quick and keep
Right.
everything looking nice and pristine. So yeah, I think it's a newer trend, and I hope that it continues, because that's what should happen in any industry. And I'm going to obviously hone the point in specifically healthcare.
Yeah.
We need to change and find out what's going to be better for the patient experience, and the family experience, because family members become patients. And like you said, word of mouth helps.
Right. Right. So I think it's important for colleagues to just keep in mind, we're not privy to some of those conversations of the bigger things. And, sometimes a management has come and said, these are some of the things that we're looking at, right? And so it's helpful to feel like we're a part of the bigger picture.
Yeah.
I've appreciated that when I've been a part of those things. So, but it's a challenge when you're dealing with certain things. A few weeks ago, talked to a man named Hunter Hayes who does consulting, not country singing, but consulting for hospitals and um, the corporate thing. And we said, we can't judge the administrators of hospitals unless we've walked in their shoes, right? Because their decisions are shift and affect so many people that their job isn't easy either, and
Right. Yeah.
certainly wouldn't want that job. But it's certainly helpful when we're all on the same team, trying to, collaborate the same way, you know. So that's I think an important part to keep in mind when you are just getting out of ultrasound school and you take a job and you want to be a part of a team to continue
Mhm.
to be an encouraging, positive role model, just whether you're there just out of school or 28 or 30 years.
Yeah.
So, yeah, it's part of self improvement or growth. Having a growth mindset is what I call it. Um, to always constantly challenge yourself to what can I do to be a team player,
Yeah.
right? Well, thanks so much, Dr. Gray, for your, again, valuable experience and sharing those nuggets of contrast of going from education to healthcare and going from technology to, or technologist to management. Those are some uh, hard shifts to sometimes wrap your brain around. And when you're responsible for more people and more people are more moving parts, I think as well, that can also be a challenge. But I hope our audience comes away with ideas and nuggets of information on how they can apply this to their own practice. And we can all come together as healthcare um, for the positive. So thank you so much.
You're very welcome. I hope for the same thing, and thank you for having me on. It's a pleasure as always. Keep doing what you do because you definitely have a big influence in healthcare, not only as a technologist but as a podcaster.
Thank you so much. I appreciate it. Thank you for tuning in to It's All About the Frequency podcast. I hope you enjoyed today's episode. Share it with a friend and remember to keep your frequency high.